a lot of people don't know the history of the union. They don't associate themselves with chanting or marching or striking, you know, like that's very foreign to them. They haven't grown up with that, and you know, they didn't live through the 70s or the 80s when nurses did work very hard for improved wages and improved working conditions. And so, you know, money's not everything. And so you can, you know, increase wages and you can, you know, people work overtime, but it only lasts for so long. And I think, you know, working conditions, job satisfaction, you know, those are really important things. And I think that we have achieved many things through bargaining that have looked at a lot of those issues, but you know, it's still a fight. It still kind of needs to move forward. And when you look at the typical graduate now, like they are a little bit older sometimes it's, you know, an after degree, like they're really pushing nurses through the system because they need more nurses. But you kind of need to look at, yes, you're pushing more nurses through, but then are they just going through and after 2 years are leaving the profession because, you know, they're not interested in poor working conditions. So, you know, a lot of people have, like at my particular site, like we see a lot of after degree students. So these are people that have a master's in something else, or they have an undergrad in something else. And so, you know, they're interested in nursing and they like the different aspects that nursing has to offer. Like, you know, they go into it for the caring part of the profession, but there's also other things that lead them that direction. And so if that's not filling their need, you know, I think that they're going to be that much quicker to leave. And I think it's different than the generation of 20, 30 years ago where, you know, you join teaching and that's what you do. You join nursing and that's what you do for the rest of your life. You know, we live in a day and age where people are changing their careers, you know, sometimes 2 to 3 times in their lifetime. When you're dealing with an increased population and not a whole lot of staffing changes, then you're dealing with very task-orientated kind of nursing care, which is not truly what community health nursing would be involved in. You know, we'd be looking at that family as a whole, or we'd be looking at their issues as a whole and trying to provide that continuing care versus just kind of the task of immunization or just the task of doing a baby visit. You know, there's follow-up that's involved with that, and it's sometimes challenging when the staffing levels just aren't there to complete that, and it doesn't always make you feel very good as a nurse when you're not able to follow a family like you should. You know, we go into the nursing profession because we care, and it's hard when you're challenged in you know, appropriate staffing levels.